Now, scathing accusations at a D.C. hospital. In less than 4 hours, nurses at Northwest D.C.'s Medstar Washington Hospital Center are planning to protest, accusing the hospital of wage theft.
And that's where we find our Lionel Donovan this morning. And Lionel, really pay disputes are at the center of this strike. Good morning.
Good morning. In fact, nurses are actually planning a protest that is going to be happening here later this morning at 9 a.m. Now, these nurses here at Medstar have filed a formal complaint with the D.C. Office of the Attorney General on Monday. That complaint says that the hospital falsified pay records and may have been paying nurses late for more than a year. And now those nurses want answers. The union, National Nurses United, says that the hospital added lunch breaks to the pay records of ER nurses, even when they couldn't take those lunch breaks, and also says operating room nurses have been paid late. The union also accuses Medstar of fostering a work culture that encourages staff to come early or stay late without clocking overtime pay. So far, the union estimates that about 80 nurses have had lunch breaks added to their paychecks, and about 50 operating room nurses may have been paid late, and over 800 nurses have overtime work concerns. Julia Truelove, who works at Medstar, says as flu cases surge, it's critical that every hour of work is recognized.
If you miss a meal break, you deserve to be paid for that time you were working. And so for nurses to have their time cards modified after the fact without their knowledge means your employer is sticking their hand in your pocket. But it is not your job to make sure you're paid fairly, it's your boss's job. Your boss is in charge. That's why we've filed with the DC Office of the Attorney General, because this is an issue with our employer.
Now, WUSA 9 did reach out to Medstar to hear what they had to say about this complaint. A spokesperson for the hospital did get back to us and sent us a statement that reads in part, "We immediately began looking into those concerns, and where we have confirmed a mistake, we have issued corrected paychecks to impacted nurses. We are continuing our review and will expedite correction of any errors we identify." Back to you guys.
For us this morning, thank you. At 6